Welcome to the 2022 CNA Basic Nursing Skills Practice Test. This test has 70 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it blue. Question 1. A CNA is recording the 24-hour urine output of a patient with kidney issues. What 24-hour urine value would warrant a report to the nurse? A. 800 cc. B. 1400 cc. C. 1900 cc. D. 600 cc. The correct answer is D. 600 cc. The normal 24-hour urine output for a patient should be between 800 and 2000 cc. 600 cc of urine in 24 hours could indicate a complication and should be reported. Question 2. A resident drinks 8 ounces of milk during lunch, but the standard measurement of documentation in the facility is cubic centimeters, cc. What value would the nursing assistant record? A. 240 cc. B. 360 cc. C. 120 cc. D. 8 cc. The correct answer is A. 240 cc. There are approximately 30 cc in every ounce, so 8 ounces is equal to approximately 240 cc of fluid. Question 3. You are caring for a patient with a strict dysphagia diet. Which item on the patient's tray would you question? A. Peanut butter. B. Chocolate pudding. C. Applesauce. D. Mashed potatoes and gravy. The correct answer is A. Peanut butter. Those with a strict dysphagia diet have difficulty swallowing, so the foods they eat must be pureed and of thin consistency. Peanut butter, Jell-O, and fruited yogurt would all be considered too textured for someone on a strict dysphagia diet. Question 4. There is a sign that says NPO on your patient's door. You know this means A. The patient is at risk for falls. B. The patient is under isolation precautions. C. The patient can only have liquids. D. The patient cannot have anything by mouth. The correct answer is D. The patient cannot have anything by mouth. If patients are NPO, they are not allowed to have any food or fluids by mouth. Question 5. Your patient has a low pulse, seems slightly confused, and has sweet, fruity-smelling breath. You suspect A. Hypertension, B. Hypoglycemia, C. Hypotension, D. Hyperglycemia. The correct answer is D. Hyperglycemia. Hyperglycemia, or high blood sugar, is marked by slurred speech, low pulse, warm skin, sluggish or confused demeanor, deep respirations, and fruity or sweet-smelling breath. Question 6. Which of these would be inappropriate when caring for a diabetic patient? A. Keeping the patient's feet clean and dry. B. Carefully monitoring and reporting the patient's food consumption. C. Ensuring the patient has plenty of snacks to eat throughout the day. D. Offering the patient a thermal foot soak once a day to relax. The correct answer is D. Offering the patient a thermal foot soak once a day to relax. Patients with diabetes can have diabetic neuropathy, which means they have a decreased sensation in their extremities. If the patient soaks his or her feet in hot water, he or she could sustain tissue damage, as he or she may not be able to tell if the water is too hot. Keeping the feet clean and dry is an appropriate care tactic for diabetic patients. Diabetic patients should eat several snacks throughout the day to keep their blood sugar stable, and their overall intake should be monitored and reported to prevent large blood sugar swings. Question 7. A fractured hip is A. The most difficult injury from which to recover. B. The most frequent injury when a resident falls. C. The most expensive injury for rehabilitation. D. The injury that generates the most complaints from residents. The correct answer is B. The most frequent injury when a resident falls. A fractured hip is the most frequent of all injuries when a resident falls. The other options are varied depending on the resident's age, the overall health of the resident, or how fractured the hip may be. Question 8. As a CNA, you become an advocate for the residents that you care for. This means that you A. Help them make difficult decisions regarding their care. B. Ask questions regarding their care. C. Complain when something that they don't like is done. D. Communicate their needs when they might not be able to. The correct answer is D. Communicate their needs when they might not be able to. Because you will likely spend more time with your residents than any other member of the healthcare team, you will have very close interactions with them. This will lead you to befriending them and becoming their advocate, which is communicating their needs when they might not be able to. Question 9. You should be careful when changing blank, as this is a common site for unintentionally discarded needles. A. A resident's bed linens. B. A resident's clothing. C. A resident's bath towels and washcloths. D. A resident's trash bag. The correct answer is A. A resident's bed linens. As many procedures requiring the use of needles and other sharps are done at the bedside, the bed linens may be a place where extra precaution is needed when changing, as they may be a common site for unintentionally discarded needles. Question 10. When having a conversation with a dysphagic patient, someone who has trouble speaking, it is important not to blank. A. Finish what you believe they are trying to say for them. B. Encourage them to use all of their senses to convey their needs. C. Praise their efforts. D. Use visual aids and other devices such as a whiteboard. The correct answer is A. Finish what you believe they are trying to say for them. Dysphagia may occur as the result of a neurological problem, stroke or Alzheimer's disease, or a past surgery to remove a cancer from the mouth, tongue, oral cavity, or larynx, voice box. It is important to remember that although the patient's ability to communicate has been affected, their intelligence has not. Be patient and do not hurry them. Do not try to finish what you believe they are trying to say. Use visual aids and devices to help them communicate. Encourage them to use all of their senses to convey their needs, and always praise their efforts to communicate. Question 11. Which of these is not true about condom catheters? A. They are a treatment used to avoid urinary tract infections. B. They are internal catheters and not as effective B. They are internal catheters and not as effective as external catheters. C. They are more effectively used if pubic hair is removed around the area. D. They should be changed frequently. The correct answer is B. They are internal catheters and not as effective as external catheters. Condom catheters are external catheters and often described as more convenient than internal catheters. All of the other options are facts about their use. Question 12. After assisting a resident onto a bedpan, it will help to make the patient more comfortable if you blank. A. Turn on the television for distraction. B. Raise the head of the bed. C. Lower the head of the bed. D. Have a trusted loved one assist with the procedure. The correct answer is B. Raise the head of the bed. Raising the head of the bed once a resident is set on a bedpan will make them more comfortable. Turning on the television may actually interfere with the process, and the other options may make the resident more uncomfortable. Question 13. A resident has the following symptoms: expelled brown fluid from the rectum, excessive amounts of flatus, and light abdominal cramping. Which of these is most likely the cause of these symptoms? A. A blood clot. B. A stroke. C. A heart attack. D. An enema. The correct answer is D. An enema. These are common symptoms following an enema procedure. If the cramps become severe, contact the charge nurse. These are not primary symptoms indicating a heart attack, blood clot, or stroke. Question 14. Which of these is not a signal for notifying the charge nurse regarding a resident's ostomy bag? A. Pus draining out of a stoma. B. A sudden increase in the amount of stool in the pouch. C. Skin around the stoma is bulging. D. A temperature of 98.8. The correct answer is D. A temperature of 98.8. A temperature of 98.8 is considered within a normal range. Pus or bulging around the stoma or a sudden increase in stool should all be reported to the charge nurse immediately. Question 15. The medical term for a device with two soft plastic prongs that attach to a plastic tube delivering oxygen is A. An oxygen diffuser. B. A nasal shunt. C. A nasal antihistamine. D. A nasal cannula. The correct answer is D. A nasal cannula. A nasal cannula is the device that goes into the nose and helps deliver oxygen. The other options are all incorrect. Question 16. A resident with venous stasis has developed pressure sores under elastic stockings. What is the most likely cause? A. The resident is allergic to the elastic. B. The elastic stockings are the wrong treatment and should be removed. C. There are wrinkles in the elastic stockings. D. The resident has been scratching his or her legs. The correct answer is C. There are wrinkles in the elastic stockings. Wrinkles in stockings or bed sheets are a common cause of pressure sores. While the other options may cause different symptoms, pressure sores develop when there is an article pressing against the body for a period of time. Question 17. To avoid pulling the catheter when turning a patient, the catheter tube should be taped to the patient's A. Knee, B. Outer thigh, C. Bed frame, D. Upper thigh. The correct answer is D. Upper thigh. Taping the catheter to the upper thigh can help prevent inadvertent removal and physical trauma. Taping it to the outer thigh, bed frame, or knee can cause pulling and removal when you are turning a patient. Question 18. Which is the standard for measuring urinary output? A. Milliliters, B. Cups, C. Ounces, D. Liters. The correct answer is A. Milliliters. Urinary output is measured in milliliters, ml. Some facilities may still use cubic centimeters, cc, which are volumetrically equivalent to milliliters. However, the use of cubic centimeters is not considered best practice due to the abbreviation cc often being confused for the abbreviation U, meaning units. The other answers are not the correct standard of measure for this type of output. Question 19. Which is the best advice if you are uncertain you are able to move an obese patient on your own when it is time for their scheduled repositioning? A. Try to move the client alone. B. Ask the family members to assist you. C. Give the patient something sturdy to grab onto and encourage him or her to move to himself or herself. D. Ask another nursing aide to help. The correct answer is D. Ask another nursing aide to help. Always ask another nursing aide to help if a resident is too heavy and you are not sure if you can manage on your own. You do not want to risk injury to the patient or yourself. The same applies to family members. The patient is not able to move himself or herself, so this option is not appropriate in this scenario. Question 20. Which of these best describes the purpose of padded side rails? A. To protect a resident from injury. B. To prevent skin breakdown. C. To keep a resident in the proper position. D. To use as a restraint. The correct answer is A. To protect a resident from injury. Padded side rails are to protect the resident from injury. The other answers are incorrect. Question 21. A resident is ill with the following symptoms: fever, swelling, redness, and chills. The resident most likely has A. Arthritis, B. An infection, C. An allergy, D. Food poisoning. The correct answer is B. An infection. Given all of these symptoms combined, infection is the correct answer. The swelling and redness coupled with the fever indicate a local infection. The other options do not commonly have all of these symptoms combined. Question 22. Which of these would most likely be used to protect a resident from inflicting immediate harm to themselves in a care facility setting? A. Isolation, B. A watch schedule 24/7, C. Additional staff, D. Restraints. The correct answer is D. Restraints. Restraints are only used with an order from the physician and only when the resident is in danger of harm to themselves or others. Isolation increases the chance for harm, and additional staff or a 24/7 watch schedule are likely unmanageable with the number of residents and staff in a care facility. This is the correct answer given the answer choices. However, please check the regulations in your state concerning the use of restraints. There is at least one state that does not permit their use. Question 23. Which of these applies to proper hand washing procedures? A. Use friction for 15 seconds. B. Use only antibacterial soap when washing hands. C. If the soap doesn't lather, it is important to use longer friction time. D. Use a paper towel to turn off the faucet. The correct answer is D. Use a paper towel to turn off the faucet. Using a paper towel to turn off the faucet prevents transferring germs from the faucet to your hands. The other options are incorrect because friction needs to be longer than 15 seconds. Using only antibacterial soap may not be an option, and some soaps can be effective even if they do not produce a lot of lather. Question 24. Why is an axillary reading generally lower than the other forms of taking a temperature? A. It is placed deeper in the body. B. It is taken for a shorter period of time. C. It is not inside the body. D. It is taken at the back of the body. The correct answer is C. It is not inside the body. Axillary temperatures are taken in the armpit. They are not actually inside the body, such as in the mouth, rectum, or ear. The other answers are incorrect. Question 25. Which of these is the correct step in taking a radial pulse? A. Press lightly on the side of the neck with the pads of 2 fingers. B. Press lightly against the radial bone with your fingers. C. If the pulse rate is erratic, count an extra 90 seconds. D. Count the number of beats in 30 seconds and then triple it. The correct answer is B. Press lightly against the radial bone with your fingers. Taking a radial pulse requires fingers placed on the inside of the wrist against the radial bone. The count is for 60 seconds. The other options are incorrect. Question 26. Which statement is false with regard to taking a rectal temperature? A. The thermometer should be inserted 1 to 1.5 inches in an adult. B. A rectal temperature reading may be slightly higher than an oral temperature reading. C. Mercury thermometers are preferred for accuracy. D. Wipe the resident's rectum when finished if needed. The correct answer is C. Mercury thermometers are preferred for accuracy. Mercury thermometers are no longer used in medical facilities due to the dangers of mercury. The other answers are all correct pertaining to rectal temperatures. The insertion depth would be less in a child or infant. Question 27. A pulse can be taken in all of these areas except A. Behind the knee. B. The back of the head. C. The inner wrist. D. The side of the neck. The correct answer is B. The back of the head. A pulse is not taken at the back of the head, but can be taken at any of the other options. Question 28. Which statement is incorrect regarding the Heimlich maneuver? A. If the resident is coughing violently, proceed with the Heimlich maneuver immediately. B. Place your hands around the resident between the xiphoid and the umbilicus. C. To properly apply the Heimlich maneuver, make a fist with your hands. D. If you are alone and choking, you can perform the Heimlich maneuver on yourself using the back of a chair. The correct answer is A. If the resident is coughing violently, proceed with the Heimlich maneuver immediately. If the resident can cough, there is a good chance the object will be dislodged. If the resident cannot speak or cough, it is a sign you need to do the maneuver. All of the other options are correct. Question 29. A nursing assistant may help in alleviating the use of restraints on a resident using all of these suggestions except A. Bringing out a restraint so the resident is reminded they will be used if the behavior continues. B. Redirect or distract a resident. C. Becoming aware of the triggers that make a resident agitated. D. Learning what activities calm a resident down. The correct answer is A. Bringing out a restraint so the resident is reminded they will be used if the behavior continues. Threatening the use of restraints makes it a punishment and is not the appropriate action. Restraints are only used when a physician has prescribed them and is not determined by a nursing assistant. The other options can be used to help diffuse the use of restraints and may or may not work depending on the situation. Question 30. Transmission-based precautions are A. Part of the standard-based precautions for all residents. B. Added to standard-based precautions when a resident is known or suspected of having a communicable disease. C. Only used during times when an epidemic is declared. D. Not as stringent as other precautions. The correct answer is B. Added to standard-based precautions when a resident is known or suspected of having a communicable disease. When a resident is suspected or confirmed of having a disease that can be transmitted to others, Transmission-based precautions are added to standard-based precautions and are designed to interrupt the spread of disease. The other options are not true, as transmission-based precautions are not applicable for all residents, can be more stringent than other precautions, and are used more than just during an epidemic. Question 31. Which of these describes stage 4 of a decubitus ulcer? A. Superficial ulcer that looks blackened or like a deep crater. B. Open area with redness. C. Redness on the skin. D. Open area with damage reaching to the bone, joint, or tendons. The correct answer is D. Open area with damage reaching to the bone, joint, or tendons. Damage to the bone, joint, or tendons signals stage 4. Stage 1 is redness. Stage 2 is both redness and an open sore. And stage 3 may indicate a blackened or crater-like appearance. Question 32. When heat is applied to the skin, the blood vessels A. narrow, B. remain the same, C. dilate, D. constrict. The correct answer is C. dilate. Heat makes blood vessels dilate or open up. This delivers more blood to the area, helping muscles and joints relax. Heat also brings more oxygen and nutrients to the site, which promotes healing. Heat is helpful for chronic pains, such as arthritis. Question 33. Which of the following is recorded as the systolic blood pressure? A. The point where the last sound is heard. B. The point when the pulse is no longer felt. C. The point 30 mmHg above where the pulse was felt. D. The point where the first sound is heard. The correct answer is D. The point where the first sound is heard. When taking a blood pressure, inflate the cuff of the blood pressure monitor until it is snug, about 180 mmHg. Slowly release the valve of the cuff. When the blood is allowed to circulate, there will be a sound. That is the systolic pressure measurement, or the top number of the blood pressure reading. Hint: to remember which is the top number, think of the S in systolic, superior, and sky. All of them are above or high. Question 34. A fracture-type bedpan is used for residents who A. have had hip surgery, B. are in traction, C. have a back injury, D. all of the above. The correct answer is D. all of the above. A fracture pan is a smaller version of a bedpan with one side flat, which makes it easier to slide under a patient who cannot raise their hips or who must maintain alignment. The other end has a handle for easy removal. Many nurses like to powder the fracture pan to make it easier to slide and to avoid skin irritation. Question 35. When making a bed, A. raise the bed to the level of your hips. B. do not raise the bed. C. raise the bed to the level of your waist. D. raise the bed 12 inches. The correct answer is C. raise the bed to the level of your waist. To avoid back injury, raise the bed to about waist height. You should be able to stand with your back straight. Question 36. A normal adult blood pressure is A. 180 over 80, B. 116 over 70, C. 134 over 90, D. 80 over 40. The correct answer is B. 116 over 70. The American Heart Association guidelines state that a normal blood pressure for an adult is a systolic pressure of less than 120 and diastolic less than 80. Pre-hypertension levels are a systolic pressure of 120 to 139 and diastolic of 80 to 89. Hypertension begins at a systolic pressure of 140 or higher and diastolic of 90 or higher. Question 37. Which medical position can be described as the patient's head is elevated with legs either bent or straight? A. Fowler's position, B. Rose's position, C. Sims's position, D. Trendelenburg's position. The correct answer is A. Fowler's position. In Fowler's position, the head is elevated. In Trendelenburg's position, the head is lower than the feet. In Sims's position, the resident is lying on one side. In Rose's position, the head is over the end of a table. Question 38. Which of these examples demonstrates using proper body mechanics when helping to lift a resident in bed? A. Bending at the waist, knees locked, using arm muscles to lift. B. Bending at the waist, knees unlocked, using arm muscles to lift. C. Bending at the waist, knees partially flexed, using leg muscles to lift. D. Bending at the waist, knees unlocked, using back muscles to lift. The correct answer is C. Bending at the waist, knees partially flexed, using leg muscles to lift. Keeping knees flexed and using leg muscles to lift are the best options to avoid injury. The other options are not using body mechanics properly and increase the likelihood for injury. Question 39. The best use of alcohol-based sanitizer is A. When helping with catheterization. B. When hands are not visibly soiled. C. When hands have blood from a cut. D. When hands are visibly soiled. The correct answer is B. When hands are not visibly soiled. Alcohol-based sanitizers are best used for hands that are not visibly soiled. Soap and water are used when soiling is visible. The other options are not appropriate times to use alcohol-based sanitizer. Question 40. Which of these is incorrect in reference to wearing gloves? A. Always wear latex gloves because they are the most impermeable option. B. Wash your hands before putting on and after removing gloves. C. Upon removal, avoid letting the outer layer of the gloves contact your skin. D. Peel the glove away from you so it comes off inside out. The correct answer is A. Always wear latex gloves because they are the most impermeable option. Latex gloves may not necessarily be the best choice because of latex allergies. The other options are all necessary precautions that should be used. Question 41. If you are walking with a resident and they fall, which of these is not an action you should take? A. Supply information for the nurse so proper documentation can be made. B. Inform the nurse. C. Help the resident off the floor and into the nearest chair. D. Keep the resident from moving until you can assess if they have injuries. The correct answer is C. Help the resident off the floor and into the nearest chair. Helping the resident off the floor and into the nearest chair is not an immediate action to take. A serious injury might become worse if the resident is moved. The other actions are all necessary in the process of dealing with a resident who has fallen. Question 42. The medical term tetraplegia, meaning paralysis of all four extremities, is often used interchangeably with the term A. Quadriplegia, B. Hemiplegia, C. Paraplegia, D. Cardioplegia. The correct answer is A. Quadriplegia. Quadriplegia is another word used for tetraplegia, both of which mean paralysis of all four extremities. Hemiplegia is paralysis of one side, cardioplegia is paralysis of the heart, and paraplegia is paralysis of just the legs. Question 43. Which of these is not true when taking a blood pressure reading? A. The optimum position for the resident is sitting with both feet on the floor. B. It is best if the resident does not talk while his or her blood pressure reading is being taken. C. Blood pressure readings can be a little higher in the mornings. D. The optimum position for the resident is lying down with his or her feet elevated. The correct answer is D. The optimum position for the resident is lying down with his or her feet elevated. It is not optimum to have a resident lying down for a blood pressure reading. All of the other options are true considerations for optimum results. Question 44. A resident has the following symptoms: dizziness, feeling faint, blood pressure below 90/60, and cold, sweaty skin. The resident is most likely suffering from A. Hypertension, B. Hypodermia, C. Hypoglottis, D. Hypotension. The correct answer is D. Hypotension. Hypotension is low blood pressure, and all these symptoms are associated with it. Hypodermia is the medical term for tissue under the epidermis, hypoglottis is the underside of the tongue, and hypertension is high blood pressure. Question 45. The normal pulse rate for an adult is 60 to 100 beats per minute. The normal pulse rate for children is A. 70 to 120 beats per minute, B. 60 to 100 beats per minute, C. 55 to 105 beats per minute, D. 40 to 60 beats per minute. The correct answer is A. 70 to 120 beats per minute. A range of 70 to 120 is normal for young children. Babies up to 1 year old can have even higher pulse rates. The other options could apply to adults or conditioned athletes but are incorrect for children. Question 46. Alcohol-based hand cleanser is appropriate for all of these situations except A. When soap and water are not available. B. After walking a resident down the hall. C. When hands have observable dirt. D. After handling a resident's clothes. The correct answer is C. When hands have observable dirt. Observable dirt that is visible on hands requires soap and water. The other options are all considered times that alcohol-based hand cleanser could be used. Question 47. Which of these is not true about the proper procedure for taking a tympanic membrane temperature with an electric thermometer? A. Use a speculum cover that is twisted securely in place. B. Be sure the ear is free of cerumen, earwax, before inserting the unit. C. Wait for the unit to signal before removing the speculum. D. Be sure that the speculum fits snugly by pulling gently on the ear pinna. The correct answer is B. Be sure the ear is free of cerumen, earwax, before inserting the unit. Do not attempt to remove cerumen from the ear canal before taking a tympanic membrane temperature. All of the other answer choices are procedures that should be followed. Question 48. If you are helping a resident put on a clean nightshirt and it falls to the ground before you get started, it is best to A. Ask the resident if they want to go ahead and use the drop shirt. B. Place the shirt on the chair and go to get a clean garment. C. Tell the resident to wear the shirt until you can go and get a clean one. D. Put the shirt in the hamper for cleaning and get another clean garment. The correct answer is D. Put the shirt in the hamper for cleaning and get another clean garment. Picking up something that is dropped to the floor and then using it on a resident can cause contamination and infection. The resident may not make the best decision and should not choose. Placing the shirt on a chair can be easily forgotten, and the resident could pick it up at a later time and put it on. Question 49. Convulsions are associated with A. A spasm, B. A tear, C. A seizure, D. A sprain. The correct answer is C. A seizure. Convulsion is a term often used interchangeably with seizures. The other options are all incorrect. Question 50. When muscle tissue shortens and then a joint becomes hard to move, it is called A. A perforation, B. A contracture, C. A twitch, D. A rupture. The correct answer is B. A contracture. Contracture is the shortening of muscle tissue, making stretching difficult. A rupture is when something bursts open. A twitch is a sudden jerking movement. A perforation is an opening. Question 51. Which of these tasks related to intravenous therapy is in the scope of responsibilities for a nursing assistant? A. Get the intravenous feed into the patient and then call the supervising nurse to assess. B. Nursing assistants are not allowed to be involved in the intravenous process. C. Prepare the proper solution. D. Watch the drip and report any problems. The correct answer is D. Watch the drip and report any problems. A nursing assistant can watch the flow of solution and then report any problems to the charge nurse. The nursing assistant cannot start the feed nor prepare the solution. Question 52. If you smell smoke and discover a resident smoking in his room, it is best to A. Have him stop and remind him of the facility policies because of the hazards it creates to every resident. B. Tell the resident you will allow him to finish his cigarette, but you are obligated to report it if it happens again. C. Call the family contact and ask them to deal with their loved one on this issue. D. Ignore the first incident, but report it if it happens again with the same resident. The correct answer is A. Have him stop and remind him of the facility policies because of the hazards it creates to every resident. The resident needs to stop and to know you will not allow his behavior to continue. He also may need to be reminded of the policies and hazards. The other options are not the proper way to immediately deal with the situation. Question 53. A resident is supposed to have 240 milliliters of juice every 2 hours. Which of these choices would be the most convenient to meet this requirement? A. 12-ounce can of juice. B. 8-ounce can of juice. C. 5-ounce can of juice. D. 4-ounce can of juice. The correct answer is B. 8-ounce can of juice. There's approximately 30 milliliters for every ounce, so an 8-ounce can of juice is the exact requirement. The other options could be used but are not the most convenient. Question 54. All of these might be used in dealing with contractures except A. Hand roll, B. Repositioning, C. Bandaging, D. Physical therapy. The correct answer is C. Bandaging. Contractures involve the degeneration and stiffening of joints. Bandaging is not used as a method of prevention or treatment. The other options are all possible ways of preventing contractures from happening or loosening joints after contraction has occurred. Question 55. Hypertension is a medical term for A. High blood pressure, B. High anxiety, C. Hyperactivity, D. Tense muscles. The correct answer is A. High blood pressure. The medical term for high blood pressure is hypertension. The other options are incorrect. Question 56. To minimize the spread of bacteria, further infection, and contamination, which procedure should be used for washing the perineum of a resident with a catheter? A. Wash from the meatus out. B. Wash from the rectum to the scrotum. C. Wash with peroxide. D. Wash from the rectum to the meatus. The correct answer is A. Wash from the meatus out. Washing from the meatus out is correct because it avoids further spread of contamination. Peroxide is not a cleanser, and the other two options are in the opposite direction they should be in. Question 57. Which of these should not be part of the process for cleaning a resident's dentures? A. Rinsing thoroughly. B. Placing clean dentures on top of a tissue on the resident's table. C. Patting the sink. D. Washing your hands. The correct answer is B. Placing clean dentures on top of a tissue on the resident's table. Placing dentures on a tissue could lead to dentures being knocked off and damaged, or a housekeeper removing the tissue and inadvertently throwing the dentures in the trash. The other options are extremely important to the washing process. Question 58. A resident in your care has called you for help. He claims he can't find his dentures. As a nursing assistant, it is your responsibility to A. Notify the supervising nurse. B. Document the loss in the patient's medical record. C. Tell the resident that you will notify the family contact member. D. Ask the resident to refrain from eating until the dentures are located. The correct answer is A. Notify the supervising nurse. The supervising nurse should be notified. He or she will determine the appropriate documentation of the incident. It is not a nursing assistant's role to contact the family members or make a decision that the resident should stop eating. Question 59. Applying friction in the hand washing process is very important. According to CDC recommendations, the scrubbing portion of hand washing should take A. 60 seconds, B. 10 seconds, C. 20 seconds, D. Any amount of time as long as you scrub until hands feel clean. The correct answer is C. 20 seconds. 20 seconds is the suggested recommendation for proper friction. To make sure you are scrubbing for the correct amount of time, it is often suggested you sing or hum Happy Birthday to yourself twice while washing. Question 60. All of these precautions should be followed when using a transfer gate belt except A. Never using a frayed or worn transfer gate belt. B. Placing transfer belts around the resident's waist. C. Not worrying about proper body mechanics. D. Slightly rocking and pulling when using a gate belt on a resident in a sitting position. The correct answer is C. Not worrying about proper body mechanics. Proper body mechanics are always used to avoid injury and should never be ignored. The other options are all useful precautions. Question 61. Which of these is considered an accurate method for counting respiration rate? A. The resident counts to 30 while the nursing assistant counts respirations. B. The nursing assistant watches the abdomen while the nurse looks at her watch to time 30 seconds. C. The resident counts to 30 while the nursing assistant counts respirations. D. The nursing assistant looks at the resident's abdomen and a watch at the same time. The correct answer is D. The nursing assistant looks at the resident's abdomen and a watch at the same time. The nursing assistant monitors a watch for a 30-second interval while observing the resident's abdomen. The other options could produce an inaccurate result. Question 62. To obtain the most accurate patient weight, the nursing assistant should weigh the patient A. directly after a meal, B. with 2 different scales, C. 3 to 4 hours after eating, D. at the same time every day. The correct answer is D. at the same time every day. Weighing the patient at the same time every day will yield the most accurate results, as the patient is likely in similar circumstances. Question 63. A nursing assistant is instructed to take the oral temperature of a patient who just had a cold drink. The patient's temperature should be taken A. 3 to 5 minutes after the drink was finished, B. 15 minutes after the drink was finished, C. immediately. A cold drink should not affect the reading of most oral thermometers, D. 20 to 30 minutes after the drink was finished. The correct answer is B. 15 minutes after the drink was finished. A delay of 15 minutes should be enough time for the oral cavity to return to a more accurate body temperature. Question 64. A nursing assistant is caring for a patient with MRSA and is wearing a gown and gloves whenever she provides the patient care. When she needs to go care for another patient, she should dispose of her gown and gloves A. in the dirty utility room, B. in the hallway, C. in the current patient's room, D. in the next patient's room before touching that patient. The correct answer is C. in the current patient's room. Taking the gown and gloves off in the patient's room before leaving to care for another patient helps reduce the spread of infection to staff and other patients. Question 65. Another term for decubitus ulcer is A. pressure sore, B. perforation, C. ulcerated cyst, D. ulcerated tumor. The correct answer is A. pressure sore. The term pressure sore is actually a more accurate term to use than decubitus ulcer. The other options are incorrect. Question 66. Why is taking a resident's oral temperature the most common means of obtaining a reading? A. It is the only method residents will accept. B. It is the most cost-effective means of taking a temperature. C. It offers the most ease of access and least inconvenience to the resident. D. It is more accurate than other methods. The correct answer is C. It offers the most ease of access and least inconvenience to the resident. Ease of using this method makes it the most preferable. The other answer options are not necessarily true. Question 67. When transferring a resident from a wheelchair to stationary chair, the nursing assistant should stand A. in front of the wheelchair, B. to the right side of the wheelchair, C. behind the wheelchair, D. to the left of the side of the wheelchair. The correct answer is A. in front of the wheelchair. Standing in front of the wheelchair is the most ergonomic way for the nursing assistant to pivot a resident into a stationary chair. The other options are not as effective for allowing this. Question 68. Which of these could be considered neglectful when assisting a resident with showering? A. Respecting the fact that bathing and showering can be a scary activity for residents and assuring them you will help them through the process. B. Being patient and calm and explaining what you are going to do before you do it. C. Leaving the resident alone so they are motivated to care for themselves. D. Being sensitive to water temperature and testing it before beginning the procedure. The correct answer is C. Leaving the resident alone so they are motivated to care for themselves. Residents left alone in the shower could slip and fall. Leaving a resident alone is considered neglect. All of the other options show care for the patient and his or her rights. Question 69. A resident in your care is suffering chest pains. Which of these is not a direction to follow? A. Offer support and reassurance. B. Talk and act in a calm manner. C. Have the resident take small sips of water and place them in a downright position. D. Call for help immediately. The correct answer is C. Have the resident take small sips of water and place them in a downright position. Patients suffering chest pain should not have water or foods until they can be assessed by other members of the healthcare team. A prone position is not appropriate for chest pains. All of the other options are important in the treatment of your resident. Question 70. All of these are ways to prevent pressure sores except A. Changing soiled sheets quickly. B. Changing positions regularly. C. Providing extra blankets. D. Avoiding wrinkles in sheets. The correct answer is The correct answer is C. Providing extra blankets. Providing extra blankets will not necessarily help with pressure sores. The other options all assist in pressure sore prevention. Let's be honest. The CNA exam is hard, and the CNA exam is important. And to do well on the exam, it matters how you prep, not just how much you prep. That's why we at All Healthcare Careers have developed a work smarter, not harder philosophy. We will help you achieve maximum results in minimum time. To maximize your chances, we suggest that you sign up for CNA Premium. To help you get that score of 80% or higher, we'll make sure that you get your very own dedicated CNA study manager who will help you fix any CNA weaknesses you may have. You'll also have access to full-length practice tests, CNA flashcards, as well as our CNA Skills online module and customized homework assignments. You'll complete study missions that will help you be laser-focused on the areas that you need to improve and won't waste your precious time on materials you've already mastered. We are so confident that you will pass your CNA exam after studying with CNA Premium. We guarantee it. It's effective, it's efficient, and you will improve a lot. If that sounds interesting to you, then click the first link in the description to join CNA Premium for a 3-day trial. We can't wait to help you with your dream of becoming a CNA. Thank you for watching this video. We hope you enjoyed it. Check out these other videos that could help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel. And please share this video with your fellow nursing friends.